In an attempt to increase awareness on aspects of care, also on a day which we celebrate as Happy Women's Day, it is important to look at a pledge that we all take towards contributing health of individuals and society on a Women's Day. Let's take it forward on a journey of silent issues which happen to women in my subject of urology at the Kokilaben Dhirubhai Ambani Hospital, where we treat individuals coming from different walks of life, from different cities and different countries. Friends, I'm Dr. Sanjay Pandey at the Kokilaben Dhirubhai Ambani Hospital in Mumbai, in India. An aspect of care which we need to talk on a Happy Women's Day is about the tribute that you pay to them in many aspects that they actually take and empower the entire society, entire house, home, and the workplace they work in. And therefore, while we wish them pink of health, while we wish them all sunshine in their life, which they bring to all of us, it is important for us to look at least one aspect of care which is missed out by many of us in urology. Friends, interstitial cystitis bladder pain syndrome is the name of a disease process which a lot of women go through. Women, more commonly than men, suffer with this entity, which actually is about a situation where a woman complains of discomfort in the lower part. Now, the discomfort could even be a pain, could even be a pressure in that part, or just could be a kind of a stabbing, burning issue in the lower part of the abdomen. That's where is the bladder which fills up. So urinary bladder in the lowest part of the pelvis gradually fills up as the kidney produces urine. And remember, every 2, 3, 4 hours we go to the washroom where the bladder contracts and pushes urine out and urine comes out. In interstitial cystitis bladder pain syndrome, an issue where women go through the agony silently, not over days, not over hours, but over weeks, months, years, and even decades, where a change happens in the level of the bladder and brings about all those discomfort which she's suffering. And it goes on and on and on. And this discomfort doesn't stay as static as it looks like, but it could be progressive. And what happens there is what we need to know. So women across the world could perhaps be suffering with pain on bladder filling up. As the urinary bladder fill up, we get a sensation and then we excuse ourselves from meetings, go to the washroom and empty our bladder. That may not be happening with women who suffer with interstitial cystitis, who suffer with bladder pain syndrome, the combined conglomeration of these entities, which has been actually the hallmark of a lot of individuals who go through burning sensation, discomfort, pain, and they perhaps don't know whom to go to. They are treated. They're treated well in many locations, but they perhaps many a times have missed out on the diagnosis. Therefore, at the Kokilam Dhirubhai Ambani Hospital over the last 17 years since the inception of the hospital, in the Department of Urology, that I've seen patients between ABCD and XYZ on the symptom complex progress over months, over years, and over decades, having undergone treatment while the disease progresses in a different direction. There could be two aspects to it. One aspect is probably a missed out diagnosis. Women need to go more frequently, and probably this could be labeled as an overactive bladder. Overactive bladder is where the bladder makes you run again and again as a result of the sensitivity that the bladder lining has. And therefore, you have increased frequency, urgency, and sometimes urge incontinence and some dribble. But that is only overactive bladder. Let's not label overactive bladder when you have got a discomfort, pain, pressure, burning, and all those things don't amount to overactive bladder. On the other side, many women would land up with urinary tract infection as a result of the anatomy that is made for women. The anatomy of the women is such that the urinary passage is surrounded by bacteria coming out of the vagina, coming out of the rectum. Therefore, the introitus is soiled with bacteria, which a woman continues to maintain a great hygiene because of the anatomical aptitude that it's there at the lower part. Many women go through urinary tract infection. But UTI, which again is sadly labeled as everything being a UTI for women, is not true. UTI classically is a symptom complex where a woman complains of burning, discomfort, strangery, overactivity again and again, and has to rush. But all this is over hours and over days. There's something of a sudden onset bacterial invasion into the bladder from the introitus, from the region of the vagina and the rectum, as a result of many requirements that the woman could have. Anatomy is one. The other is post-sexual activity hygiene, the basic hygiene demand for a woman post-menopausal state where the hormones are gone and the woman can develop infection. So women develop UTI and women develop recurrent UTI is known to us. But Let's not label pain, pressure, discomfort lasting for weeks, months, years, and decades, and is progressing and undergoes a flare as recurrent UTI. So, at least two misdiagnoses of recurrent UTI in overactive bladder, which again is common in women, has been sadly placed in many women who go through discomfort, discomfort, and discomfort. Women complain of increased frequency, but they also complain of burning sensation in the lower part. Not necessarily when they pass urine, but there's burning, there's pain, there's discomfort. And there's not a 1 day, 1 week affair. This has been lasting for months or years. And these women possibly could be interstitial cystitis bladder pain syndrome, a large symptom complex. A lot of things happening inside them. The bladder lining doesn't listen to them. It makes them run again and again because of the discomfort which happens when the bladder fills up and they're never able to fill the bladder to near capacity. While all this is happening, they continue to suffer. They continue to take their medication as prescribed by the doctors, whom they continue to see across the country, across various subspecialties. And we all know that if you have a urinary complaint, please see your urologist in your locations. This disease is quite hidden, missed out in diagnosis, and probably is not a static disease, it's a progressive disease. The phenotypes which can progress can also lead to a bladder capacity gradually shrinking. So why not wake up to a phenomena where if we have got in our mature years, which could be anything between late 20s to 70s, more commonly in women than men, discomfort in the lower part, burning in the lower part, cannot hold urine because I've got pain, pain, pain. I've got pressure out there. I've got a discomfort which doesn't let me hold urine. I get up at night with discomfort, pain, pressure, and burning, and I want to pass urine to empty my bladder. Not because the bladder is too full, not because I've reached my bladder capacity, but because the bladder is feeling like full and I have to empty urine. Could be a case of interstitial cystitis bladder pain syndrome. Friends, women across the world suffer in all strata of society. Men do have this problem. It is not a gender exclusive disease, and people could be having various kinds of syndromes. Some could be having a very bladder centric disease. Some could be having a very mucosal centric disease, which causes pancystitis and the interstitium getting involved. Some may have a bladder centric disease without visibility of anything in the cystoscopy for a urologist, and he may say there's no problem. This happens always in the absence of a UTI. So if you have a UTI and recurrent UTI, it may not be a bladder pain syndrome. It's called as a chronic pain in the region of the pelvis, which is perceived by the patient as arising from the level of the bladder because there are urinary symptoms of urgency, painful urgency, frequency, burning when the bladder fills up, and there's a relief when the patient goes to the washroom and empties the urine. So I think this is extremely important for us to wake up to a phenomena where we are suffering silently. We are attempted to be treated by our colleagues, but not necessarily the treatment has been arrived at. And while all this happens, the family also goes through the agony, searching for doctors, searching for locations, searching for therapy, and this is not uncommon. We get to see all levels of interstitial cystitis bladder pain syndrome, where many a times counseling, talking to them, evaluating, examining, and taking them on a journey of basic therapy keeps them at a baseline, not flaring up, not let them have UTIs, not let them have a stress. Empathy to the patient and the family is extremely important. But that's not all. The disease process has to be curtailed, has to be taken forward to the next level. And therefore, we understand that to a common man across the platform today who listens to this, or a common woman who probably listens to this in the society, she needs to get the empathy and confidence about a treatment that has been attempted perhaps in her city by her doctors, in her city, in her country, and has not got a result. And very important for us to reach out to you through a platform, through a media to all over the world. If you have got pain, pressure, and discomfort, if you have got burning sensation in the region of the urinary passage, if you have burning sensation in the region of the introitus, the urethra, the genital organs, when the bladder fills up, in the early days of this process of change, and that progresses to a situation where it probably could be round the clock burning pain, discomfort, there has been a progression of the phenomena. So it's very important for us to wake up to the phenomena. So let's wake up to a phenomena where this is treatable and also curable. Many of these women or men, whoever suffer from this, come and see us at the Kokalame and Dhirubhai Ambani Hospital in Mumbai, in India. And it's important for us to handhold the journey towards a recovery, towards a resolution, towards a rejuvenation and repair of whatever has happened. And therefore, we go on a journey of assessment. We assess with your food diary, we assess with your bladder diary, we assess with your past treatments, attempted results, no results, partial results. We look at the right approach to the right individual We're also looking at what is happening behind the door. So you may have undergone a cystoscopy in the past, but perhaps at that time the disease was not so flared. Perhaps at that point, somebody may have missed out because what a mind does not know, the eyes cannot see inside the bladder. We're going to look at various aspects of care during a cystoscopy: diagnostic, prognostic, a surveillance attitude, and a therapeutic aspect. So there are many things to a cystoscopy which you do by guidelines and associate it to a possible future aspect of care. It's just not looking at inside the urinary bladder that I continue to see 3 to 10 times every day. It's important for me to look into this aspect of care. So many a times you have been labeled as recurrent UTI, some antibiotics given, you got some relief, and then you continue to live in agony and discomfort of the continued baseline symptoms, which is progressive. Many times you were labeled as overactive bladder, some therapy was given, some relief here and there, and the placebo has not worked beyond a point in time. So I think we hope that this is something where we need to take up this call, probably to reach the society through many ways. Interstitial cystitis bladder pain syndrome is something which probably is a progressive disease. It's important for us to wake up that women at all walks of their life, they could be single, they could be married, they could be postmenopausal, they could be elderly, they could be having this for a long time. Many of them have got this for decades. They have got suicidal tendencies. They have been treated by colleagues in urology and various other colleagues in various specialities, but the result has not come out. At the end, it's the result matters when you cross the finish line. And therefore, we do various kinds of treatments in this. There are intravesical therapies, there are oral therapies, there are multimodal aspects of care, looking at what approach, what dose, to what times, and how to follow up. There are times when the patient's bladder would have progressed to a point where it become a smaller bladder capacity as a result of pancystitis. And a patient goes and passes urine 20, 30, 40 times a day. Gets up at night 3, 5, 7 times a day in pain, agony, discomfort, and cries, and probably leads a life and searches out to somebody who can do wonders to them. So, friends, we always sometimes become the last stop at that kind of a care which we have offered to patients from all over the globe. I also serve as secretary to the Global Interstitial Cystitis Bladder Pain Syndrome. And on 9th of March, Sunday, 2025, we celebrate this as International IC Bladder Pain Syndrome Patients Day. That's where patients come up, they speak up about their agony, they speak up about their results, they speak up about confidence building to many more people in the world. That's the day we celebrate it as International IC Patients Day around. And it's important for us to join together, help out, hand probably hold all this journey of individuals and take it in a very strength of a multidisciplinary care that we look into. We look at the families which go through this agony, where they search for doctors across in various cities and they come over. So today, from this platform, looking at interstitial cystitis bladder pain syndrome, which does not happen only in India but happens across the world. Individuals suffer, they're missed out in diagnosis, they progress, and many times they come too late when the bladder is shrunk into a small capacity fibrotic bladder, where I'll end up doing a substitution cystoplasty, completely making a new bladder out of the burnt out bladder, an augmentation cystoplasty on a moderate sized bladder where we augment and probably denervate the bladder in terms of decreasing the nerve activities and therefore this neuralgic phenomena that they go through. Many a times the pelvic floor is hypotonic and spasmodic, and we need to identify and look at our teams in pain therapy helping us out. So friends, interstitial cystitis bladder pain syndrome sadly is a disease of agony, a syndromic approach of many aspects. The changes in the bladder, changes in the pelvis, cross organ talks, the difficulties that the individual faces. There's so much in the mind of an individual who's gone through it, has already taken a therapy or treatment, got a partial result, no result, but still continues to take a while. And there are women I've seen in late 20s to women in late 70s, men in the 30s, 40s to 70s and 80s. Not to say that they've undergone a wrong treatment by undergoing a uterus removal or by a prostate removal, because what we could see is what you told, what we could see is what investigations could, but there is a time that we spend across the table picking up a lot of things around. So, friends, many a time surgeries are done out of a situation from where there is another parallel thing happening. And therefore, sometimes uterus is removed by doctors across the country and the world. Sometimes prostate surgeries have been done to help you out. But at the end of it, you not got a relief. The relief is what you are seeking with a doctor, a respected doctor in your location, in your cities around. So there are, I would not say mistakes which happen. There are these kind of attempts made to get you sorted out. And therefore, IC bladder pain syndrome is obviously a conundrum. It's quite a jigsaw puzzle waiting to be solved. And over the last 24 years in urology, I've been looking at this subject with a lot of depth. I've understood that patients come at various stages. They come sometimes with a flare up. They come sometimes with a silent, continued agony and probably don't want to live with it anymore. Sometimes they come with an aggressive downhill course where progression has happened. Sometimes the flare actually worsens the whole phenomena and it happens at all age of life. So, friends, there is treatment available. There is a therapy available. There is a progression of symptoms which happens and we curtail it completely by almost replacing a bladder, sometimes doing an ileal conduit, but it is all again chosen by the doctor. The doctor chooses what therapy he does. Many a times, a cystoscopic hydrodistension becomes quite therapeutic. There are medications to help treat the inner lining of the bladder, the medications to take the care of the neuralgia, of the pelvic floor, of the overactivity of the bladder resulting from the pancystitis, and other add-on issues about the urethra, the maters, the prostate. All those are taken care of. So basically, you land up with a multimodal therapy because a progression of change is parallel to various other anatomical changes happening around. Friends, on Women's Day again, on 8th of March 2025, one day before the International Patients Day that we celebrate at GIBS, it is important as a wake up call to bring about an awareness to all in the society, to men, to women, all over the world. It could be India, it could be Africa, it could be Asia, it could be Europe, where women suffer and they probably are missed out and labeled as only a UTI, recurrent UTI, continue to live with it. The disease is not picked up and probably not picked up at all. Many a times they are looked as overactive bladder, given medication, treatment failures continue, and they continue to live with it. Many of them continue to change their doctors and cities. The tendency is quite suicidal. There are no doctors who are able to treat me. What has happened to me? They're able to treat cancer, they're able to treat various other big diseases, but not this. It is not true. I think we need to persist with our treatment. We need to see, and probably we are very keen to help a lot of individuals who could come to Kokilaben Dhirubhai Ambani Hospital to Department of Urology, where we put in a lot of effort around to identify, to look at stratifications and algorithmic approach, phenotype patients into different aspects of care, and patients do come from various aspects. They have been treated by my colleagues in various cities, in various countries. They've got a good result. They've got a result. They come for surveillance. Many of them come for a follow up. Many of them come for a primary therapy and many of them do come with refractory diseases. If we always do what we always did, we'll always get what we always got. Friends, we need to look out of the whole situation. Thinking out of the box, we need to break free. We need to get this treated. Let's not think about a worsening situation will never get well. It has its own ways, and it probably is all wheel of fate that somebody got it because there could be umpteen reasons, quite innate and quite deep inside, which may not be picked up as pathophysiological causes all the time. But obviously, treatment is around the corner. So why miss out this aspect of care for women who have got pain when the bladder fills up, get some relief when the bladder empties? This cycle changes over years for them. Many women actually develop a flare of this, which is going on baseline after a UTI, after a stress. Many women say that in pregnancies, my symptoms mellowed down completely, but that comes back in the bank thereafter. Many women who actually had some kind of food which worsens their situation, they come over and tell that. And progression, sadly, is almost a rule in those situations whom the natural history is not halted. So I think there are many aspects of care, many aspects of the pathophysiology, and aspects of progression, something which is beyond us as human beings, as doctors too. But each patient tells a story. Each patient tells the agony, and each patient is quantified. We calibrate, quantify, and with an algorithmic approach, move up the ladder in all aspects of care. I continue to see common men in the society. I see women. I see police. I see lawyers. I see film stars. I see common man who goes through it. I see house women who are working around. I see a lot of patients from different walks in life who have attempted to treat around. People coming from different parts of the world. And I see bladder pain syndrome is treatable, can be stabilized. Your quality of life changes quite dramatically. And then we find a direction, a new meaning of life altogether compared to what we had in terms of pain, pressure, and discomfort. So, friends, wherever you are, it's important for us to connect and contact. It's important for us to take you forward in your journey. Urologists, urogynecologists are qualified. They actually come over to the GIBS annual conferences every year. They look at polishing themselves. They do their level of work, which is already a very high level of work in the subjects where they practice. To renew this to the next level, we always handhold journey of many patients who come to us at the Kokilabhe in Dhirubhai Ambani Hospital. Many patients actually send their responses, and send their agony and send their request and appointments on the email address which is mentioned below in the transcript. And many times you get to see us and we take it forward to the next possible. So let's not miss out on this aspect of care. Let's help out individuals today and on a happy Women's Day. Happiness to women, pink of health, sunshine in their lives, and giving them the best possible ever again. Thank you so much.